Our resource speaker for Part 1, entitled Dentistry, Adapting to the New Normal, is a graduate of the University of the East and awarded as UE Distinguished Dental Clinician in 1992. In 1996 to 1998, she had her postgraduate clinical residency in orthodontics in New York University International Program. In 1998, an orthodontic fellowship in orthodontic surgery as scholarship grant. A faculty of UE Graduate School program in the Department of Orthodontics from 2008 up to the present. She is the president of International Association for Orthodontics Philippines section and the president-elect of the USA section. She is frequently a guest on various TV networks on the discussion about dental health awareness. She received the highest level of educational achievement recognition granted by the IAO as a diplomate. She was also granted the Master Senior Instructor category of IAO at Puerto Rico in April 2012. She lectured internationally in Kentucky, Wisconsin, and Texas, USA to the IAO Certified Instructors Conference among all the top lecturers around the world. She has published international and national journals on topics about early and adult orthodontics. She was calibrated and appointed as International Board Case Examiner. Truly a Filipino pride as she is the only Asian lady examiner. In December 2014, she finished her Master of Science in Dental Education at UE Graduate School. She holds her clinic at Dental Avenue, SM Baliwag, Bulacan, and President Tower in Timog, Quezon City. She is a mother of 3, namely Mardi, Joffrey, and Macy. She is the wife of Mr. Francisco Lacson. She is truly an achiever and a determined goal seeker. Let's all welcome our dynamic guest lecturer, Dr. Maridin Munda Lacson.
Okay. So from my end, can you hear me and can you see the slides? Dr. Kua?
Yes, yes,
Okay,
yes
thank
po,
you
ma'am.
very much. Thank you so much for that very humble presentation. Today, I am so much privileged to be lecturing, actually maybe sharing to you what has been happening to us for the past months and nearly a year right now. So the title is COVIDified Dentistry, Adapting to the New Normal. Is it okay because I can hear my voice from any of your
Ma'am, baka meron kayong another gadget na naka-on. Pwede nyo po i-mute, kaya nagdodoble.
okay.
Okay po.
Okay, from my end, can you hear me? Okay, thank you so much. So, okay, to start with, magandang umaga, everyone. So I got also the chance to have a lecture, Dental Struggles in this Pandemic, Asked and Answered. The reason why I have to have it shown, it's because 2020 of this year, when the clinic has a lockdown and March 17. So nearly some days from now. And after which, there was an opening of the clinic, but it took nearly 2 months for us to all open it up. Together with that, this has been a very challenging time for everyone in providing safe care. And we all know that sobra pong hirap mag-start together with investing to a lot of disinfection and other gadgets in the clinic. So out of it, 198 active dentists and dental specialists were put into closure. And why am I into detailing this? The reason it's because after which of that time until this time, nearly siguro, as I said, nearly not just 6 months, but today it's nearly a year. So if you have some questions, this forum or this sharing would be able to answer some of your inquiries. Kamusta ba ang dental setup? Nakagayak ba ang mga dentista para i-welcome lahat? So not exactly for a year. We have prepared ourselves after 2 months of that clinical lockdown. So when you open a clinic, so ganito na po yung setup. To be very, very honest about it, a lot of patients are a little hesitant going to the clinic because safe ba dyan? Okay ba mga pasyente? I don't want to be sharing chairs. I want to have a 1 hour interval before another patient will come in. So truly, most of this are observed, and we are so much privileged that to look back, no, 1918 when we had the Spanish flu, World War I, this is the practice of dentistry. So lahat sila naka-mask, lahat sila naka-head cap. Ganyan po noon, kaya lang masyado silang malapit at that time. So siguro that makes it all different for us. And tingnan niyo po nung Spanish flu, ang pag-practice at pagbunot ng mga ngipin ay kakaiba din. So today, when you had it 103 years ago, from 1918 to 2021, if you were to compare, shucks, wala yatang pinagbago. To whatever it was 103 years ago, eto na naman po tayo. So now we ask ourselves, are we prepared? So we would like to tell you that the practice of dentistry has prepared itself even on those times that we are needed to be prepared. So the PPE doesn't speak only of you being dressed up with a gown. The PPE envelopes all this equipment, the face shields, the gloves. Truly, no, lahat tayo naka-prepare sa Google. Hindi tayo naka-prepare sa goggles. But of course, sa dentistry po, lalo na as we practice. I've been in practice for 29 years. So yung mga mata po natin, kailangan may salamin din doon sa loob. And of course, the glasses, the gowns, the head covers, and of course, the caps, the masks, the respirators, and of course, the shoe covers. From head to toe, ganyan pong nakaprepara ang lahat ng mga dentista. Minsan nga po, kinakatakutan na kaming tingnan eh. Pero ngayon, they are all okay with this. And soon, and maybe very, very soon, talagang sanay na po silang makita na ganito kami ngayon. I was shocked when one of the patients came to the clinic all dressed up like this. Actually, nagpapapostpone sila for a while. And then sabi nila sa akin, Dok, sandali lang, hindi pa dumarating yung PPE namin. And then I said, I'm gonna provide you with one. Only to find out, nakagayak sila. Sila ngayon ang patient's protective equipment. And this was an accident wherein the patient has really thrown his tooth on the ground together with that, and we're treating her for that purpose. And of course, as I said, hindi po nakahiwalay ang practice of dentistry sa mga emergencies na nangyayari sa ating buhay ngayon. So health din po is equating to dental health. And so we also are discussing this to the patients together with our computer, preparing them for the question and answer that they may also have at the moment. So sa pag sinabing COVIDified dentistry, how do we go about keeping you safe for us? So sabi nila, we need to get rid of men when in times of COVID. It is not because of the men itself, but because of the word that stands for it. It is the mouth, the eyes, and the nose. So how do dentists prepare for the mouth? For the eyes, we have the eye protector. And minsan, di pa nga po sanay yung mga pasyente, they keep on opening it up. And of course, the nose, when we also have the aerosol together with nearly some inches away from them na kailangan nandoon lagi sila. So again, how do we go about mouth washing? Of course, we cannot treat you when you have the face mask. Sabi nga po ng ating director, I think Mr. Jude Yap said na ngayon, very typical. Everyone should be on mask and face shield. But look at the risk of a dentist where in fact, you need to give yourself bold on that, removing the face mask and the shield in front of us. So kami po talaga ang number one in danger or in need of a protection together with that. So we also prepare you by mouth rinsing, and strictly we have it at 60 seconds, and then we ask you to wear your protector. So sa dentistry po ngayon, timing is everything. 1 minute po of mouth washing, 20 seconds po of you hand washing, And of course, sa mga dental procedures din po namin, marami rin po na timer na kailangan. So that's how strict we are in terms of timing. And it reminds me, by the way, in front of me is a stopwatch. I was informed by Dr. Maridin that I am only allowed to lecture for 25 minutes. That being said, I'm already on my 7th minute right now. So timer must also be seen everywhere. So ganyan po, halos hindi kami makahinga. Actually, nung mga unang times po na nagpa-practice kami on how this to go doffing and donning, talagang practice together with time and seal and how we go about seeking treatment na parehas po tayong komportable based on how you will go as a patient and us who will be treating you as a dentist and of course the assistants as well. So, ganyan po. Hopefully, makikita nyo po na it was not a replica of what happened in Spanish flu 1918, 103 years ago. It is more so of doubling the effort of what we are exerting. Kaya hopefully, makita nyo po yung effort namin on this and hindi po biro ang ating pinagdadaan ng lahat. So, on top of that, it's not just as colorful as you want to see it, because we want to make sure that every single patient in an interval of 30 to 1 hour before going in and out, you need to be properly stepped into knowing what should be the step-by-step procedural. So sometimes it also is needed for us to document all of this. Bakit? Kasi before, we can talk directly to the parents and tell them, oh ma'am, ito po yung kailangan suot ni David and all that. Today, hindi na po. We just talk in the messenger so that nandyan lang sila sa labas but they cannot enter the facility. That's why the name should have been not just adopting, but now it is surviving the pandemic through COVID dentistry. And as what we would like to tell you, we need to start right and practice well because it is both our protection. There are 10 dental practice ways to prevent the spread of COVID. So we ask you to wear masks when you enter. In terms of your yung pagpasok niyo sa clinic, dapat po may social distancing or physical distancing. We regret to inform you that only patients are allowed to go inside the operatory or the treatment area. The patient needs to be screened. Right now, every single community already have the QR code. So hindi na po kayo magsa-sign up. All you have to do is to give them the QR code and it would be scanned. And dun po makukuha yung thermometer and of course the oxygen saturation. And all of these other practices from the 8 to the 10 are all the practices of a dentist so that we can protect you with all these barriers, disinfectant, and of course the disposable, on how we also dispose all the sharps and all the other masks that you leave there. So it is said, that's why we need to always adopt and prepare, that Peter Daszak, a public health researcher, estimated 5,000 coronavirus strains globally waiting to be discovered. Sa bats pa lang po ito, ha? How about other sources? And of course, as dentists, we have to play our part in preparing people for this new reality. So it's not just adopting, it's not surviving, but now it is the reality. And all of these sources, we need to thank them kasi sila po ang nagre-research for us. If you have underbite, orthodontics is for you. That's why you do not delay and do not excuse yourself kasi pandemic. If you have a deep bite, orthodontics is for you. Specifically, if you've got a tonsil grading of number 3, which almost occupy the whole of your tonsil area, so it's not good. That's why you need to go about seeking orthodontic treatment. And if you're shy to smile, even though you have the mask, the truth, this is the right time for you to go about doing orthodontics. Kasi, di ba, sabi nila, pag nag-ortho ko ay nagbe-brace ka, nasa ugly duckling stage ka. So that pagka-ready na tayo, when we unmask ourselves, sobrang ganda mo na. Kaya this is the right time for you to seek your orthodontic treatment. Alam niyo po, ang dami kong pinagdaanan, not only because of the other things na ipine-prepare sa clinic, pati po mukha niyo, grabe. na-fold na po, nagkaroon na po ng wrinkles. Eh, yan yung talagang inis na inis ka na magkaroon sa'yo as you age. And more than that, I hope you will agree on this on me about the what you call the mask knee. So ayan po ang hirap mag-adapt sa mask knee. So again, if you're having that, you know what? You're normal. All you need to do is to adapt. Kaya ngayon, madami na po nilalagay din sa muka para maprotektahan kahit kaya hindi niyo po na maitatago yan. Kaya sinasabi ko rin po sa inyo, there are also some things that you should be doing inside your house that would properly keep your mask in its position. I hope you will agree on this. But you sometimes are not so aware that this is a very, very important. Come check this out. Okay, when you fold it, you have to be very careful when you do that. And then it is said that it's best na hindi nyo po tinatago siya sa mga tabi-tabi. Kailangan po nasa envelope man lang bago nyo ilagay po siya sa inyong mga halimbawa, mga bags. So para po maingatan po sila. Pero of course, it should be really in the face. But of course, if you are to keep that and you need to breathe, this is how you will have to do it. Why? Because how long does it stay there? You see, in the cardboard area, it's just 1 day. But in the metal and glass, it will take you 5 days for that. That's why you need to be very prepared on how you'll have to protect yourself. How to properly remove, because syempre, titreat na po kayo na isang dentist. So you have to make sure hindi nyo po siya hinahawakan. And dapat sa tamang area lang po nyo siya hahawakan. And alam nyo po, kahit i-video tayo ngayon lahat, sometimes most of us are guilty doing this. Kasi syempre, pagod ka na, hindi ka na makahinga, sakit-sakit na yung tenga mo, pati yung bibig mo, gusto mong makawala and all that. So you have to make sure you properly keep it kasi it defeats the purpose of protecting when you are not holding it right. So now I have a clue for you. So every time na nagma-wash po ako, alam niyo po, because we take care, we make sure na 20 seconds pinapractice talaga to. I made a clue and I made it poknat. Okay, can we all repeat that? Poknat. Poknat is you place the, poknat, ganda, di ba? So palm, and then overlap, and then crisscross. So meron ka ng pok na, nut na ngayon, nails, and then thumbs, and then, of course, show it, then it's clean. Roughly, it would be 2 happy birthdays. And of course, from there, you'll be able to get hold of the 20 seconds. But you know, lagi po kasi kung nag-hand wash ka, kung ano-ano iniisip mo. Kaya please be reminded, poknat. Poknat. Okay? So ngayon, in the clinic, we have some clinical strategies that we do. We have what you call, pag namimili na po ng mga colors sa mga pasyente, we don't give it directly to them. We have to just show it to them, and then they will tell us what color they wish to place on their braces. And of course, the normal oxygen saturation could have been between 94 to 100. And they say that patients with this has only 50%. So sa clinic din po, when you enter a dental clinic, it is being observed right now. Just so to prevent, not exactly telling you that this is a sign that there's a COVID, but the COVID pneumonia patients has shown the low saturation level of 50%. Again, this is just so to protect and maybe to also watch out. And where is this best place? It is best placed on your middle finger, which is most commonly used. But of course, data research is also available on interdigit differences. And please don't go to the clinic when you have nail polish. Please make sure that it is removed before you enter the clinic. And though, as I said, will a pulse oximeter tell if I have a coronavirus? It will not tell you. But of course, there should be some other signs and symptoms, fever, and thermometer will best monitor that. But this one will also help you in some ways. How about, Doc, I'm so afraid to go really, and I think I have an emergency. So we also do teledentistry. So what is teledentistry? This is the entire process of networking, sharing information, distant consultations, workup and analysis that is dealt with a segment of science of telemedicine or teledentistry concerned with us. And if that would be the case, I wish to ask of you to go about seeking 2 spoons and then place it in your oral cavity so that we can see it more vividly. So how do you go about that? So you have to retract it and then make it a point to wherever it is that you wish to ask a dentist, you need to focus it on that specific area so that we are prepared to prepare you. What is that so much emergency? What is it that you need to do before going to the clinic? Is it really so painful and all that? So you need to make sure that you'll be able to get hold of it. And we also have passed this to some other dentists that there would be a temporary treatment request form so that others who cannot go to their dentist and the very near dentist that goes near your area can attend to you. And we have this form. So what you should be preventing while you are not into the dental clinic, you have to prevent hiss. So kanina, men, we need to prevent men. Now, hiss, again, lalaki na naman. Okay, so hiss is hard, icy, and sticky. Please, I know everyone is at home. You want to make them so homey, but please do not spoil them and do not ruin their teeth. Because this is what happens, decalcification, mga white spots. Ano pa? So ayan, nagdudugo yung mga ngipin. So how do you go about this? Mom, please check it out. Dad, do your thing too. Please check it out and double check if there are some still food debris that you can see in between. So please, they are not clean yet. You have to make sure they are clean because they are irreversible sometimes. So that you do not blame your dentist why this is happening. You created this because of your neglect. So please go and visit the dental office. We are so prepared for you. So what are the emergencies being treated? So we have some protruding arch wire, loose brackets, wire or bands, acute infection from appliance. So that happens. And sometimes they swallow the appliance. So should you be worried about it? It depends on how well small it is. But please make sure that the dentist knows that that is what happened. And of course, see, look at this. This patient is prepared nearly 3 months ago when we had him treated. We had placed wires, we had placed expansion, and of course the brackets were bonded as well. And then after some time before the COVID, I want you to take note of the time, 3/17/20. That was the start of the mall lockdown. And that being said, if you were to notice from the time that we finished and see, from the time that we had it last seen, we saw that 4 months after, everything went back. And see, that makes it more expensive at this time. So again, we need to make sure that you are updating us on what's happening on your dental treatment. So again, we need to redo everything. This is how we adapt to the new normal and bring back all those things that needs to be restored. And of course, we need to cover up. We lost 6 months nearly of the delay because of that COVID time when they don't want to show up. So again, we were able to finish that in no time, but we wasted 6 months. And I hope you'll be able to bring back all those treatment because we're safe. You're safe to go there in the dental offices. Okay? So tingnan nyo po, maraming pagbabago, maraming gaganda sa inyo. Okay? To change a little of the topic, according to 2019 survey, the average person touches their cell phone 2,617 times daily. So how do we sterilize that? So Apple said you have to have 70% alcohol wipes or Clorox disinfecting wipes. And of course, you always have to wipe them. And please be worried that you should always be carrying with you some alcohol mist. Why? Because in the dental clinic, we do that every so often because we take shots of your dental structure. So we also have an alcohol mist there. And we have some special gadgets here. We have the UV sterilizer as well. And then we keep that. We have your cell phone locked. And then if you receive money as well, so this is where we keep that and sterilize. So ganyan ka sterilize sa clinic din. So, how about you bringing? Nako, kalimutan nyo na po ang mga LV nyo. Because today, ang uso na po ngayon ay UV. So, what is UV? Ultraviolet bag. So, kalimutan ng mga LV sa buhay muna for the meantime because we need to be a little safer now. No, not a little, but so safe because very recent, 2,400 plus daw po tayo kahapon of the pandemic. And not only that, I wish to mention Everyday Manifesto, 365 Days of No Nonsense Financial Advice by Theong Son. Sabi nila, expensive bugs are not investments, but safer bugs are investment. So you need to be very careful on that. By the way, this is how I go about lecturing to you right now. And tingnan nyo po, in the change of pandemic, tingnan nyo, ito na lang ang audience ko na nakikita ngayon. Sobrang hirap, di ba? Ang hirap mag-lecture in front of a dog right now. Because I believe, let's not look back, but rather move forward. The 10 most powerful two-letter word would be, if it is to be, it is up to me. So the PH ranks in dental health the highest number of wearing dentures in Asia. And how do we go about that? Because kulang daw po tayo ng follow-up. So ngayon, please follow up na po tayo sa ating mga dentista. What are the 4 F's in life? Faith, family, fitness, and finances. So as I end nearly 23 minutes of lecture to you right now, I wish to thank the people who is behind here. And of course, the most important that you have right now is a balance of everything, a balance of being. Being holy, happy, healthy, and wealthy. This is how to become a happy retiree. Nearly 9 years from now, I wish to retire. But to whatever matters to us most, I wish that you will also remember how important it is. We are in a transition sequence right now. To be very honest, we are already hopefully in the growth and direction. Now we are into the new beginning. We need to be abreast on this adaptation to the new normal. And as we go about in line of commitment, service comes with sacrifice and dedication. You are a frontliner. So there is this thing that happened to us now that I am 50. We need to be man enough to face this. And as I age at age 88 by that time, I don't want to go back at age 12. So hopefully we'll mature and we'll live longer serving the people around us. And thank you for the opportunity to share. I am 1 minute advance. With the realization of the uncertainty of time, we recognize the need to be prepared at all times. This is All That Matters by Francis Kong. And as this generation questions the uncertainty of today, then you know the challenges we face tomorrow. We need to be brave and we will weather the storm for sure. Because 100 years ago, they were able to surpass it. Ano ba naman yung 100 years ulit? The changing trends, the impact on the future of dentistry, because the future is now and it is today. And together with that, I hope you can visit us in the International Association for Orthodontics. This is our official Facebook group. And thank you for the Chiang Kai-shek College webinar hosted by the Health Services Department. From the bottom of my heart, I wish to be thankful and gratified to Dr. Mary Ann Kuo, who has been very, very supportive to all of you. And thank you for the invitation right now. I am into my life's checklist in terms of relationships, profession, funds, and leisure. And I hope, I wish to thank you again for your presence today. I am exactly 25 minutes as of this time. Maraming salamat po.